Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. Today, I'm excited to introduce you to Annie Howard. Annie is a concussion physical therapist located in Park City, Utah, and owner of Happy Brain Physical Therapy. She is certified in concussion, vestibular therapy, and treating visual and oculomotor deficits. After working as a PT for over 10 years, she had her own concussion injury, and after struggling to get better, sought out learning all things concussion. She understands the struggles that people face when their concussion symptoms don't resolve quickly and seeks to educate people about what a concussion is and how they can get better. She loves living in her mountain community and can be found out on the trails and climbing mountains in her free time. Thank you so much for being here, Annie. I'm excited for this conversation.
Thank you for having me. It's such an honor to be here.
Yeah, I have to say too at the beginning here that Annie and I had a really nice long chat on the phone a little while ago, and she is awesome. So I'm really excited for this conversation to happen and for her to get to share all of her goodness with you guys. So let's start with having you share a little bit more about you. Where are you from and what do you love?
So I grew up just outside of New York City in a suburb in Connecticut, and I moved out to Park City in 2003 after my older sister was living here. I was just going to come for one winter and get a taste of the mountain lifestyle, and then she sucked me in.
I love it. You can't go away once you're here. I get it.
It is true. It is sunny every day, and there is no humidity.
That is a big deal.
Yeah. Yeah. And it's just a little bit of a different lifestyle. I was living in New York City at the time, and it was nice to come out here and have kind of the mountains and the outdoor life be a huge part of the lifestyle, a huge part of the social community. So I just kind of became addicted to this lifestyle and stayed.
That's awesome. It is a good lifestyle. So what got you interested in physical therapy initially? And then how did you end up kind of focusing in on concussion?
Well, I was always into sports and things. And actually my first year living here, I tore my ACL. And I'd always thought physical therapy sounded interesting, but I'd never really thought about it. I hadn't taken too many science classes in school. In college, I was actually a French and English major at the University of Vermont. And I tore my ACL and I was rehabbing, and I thought, this seems like a really cool profession. It's, you're working with people, you're helping people to feel better, not sitting behind a desk all day. And it seemed like there were just so many options of different areas. Like within physical therapy, there's so many different things that you can do. And I'm somebody who really likes variety. So that's how it happened.
Awesome. That does seem like a good mix of a lot of things that are interesting to you. And I feel the same way, which is probably why we're friends.
Yeah, exactly.
Yeah, therapists. Yeah, we tend to like a lot of the same things. So that's awesome. So for some reason, I was thinking you were already a PT when you moved out here, but you weren't. Hadn't done any of that. So where did you end up going to school, and how did that play out?
So then I'm looking at schools and applying to lots of different places, and I really wanted to travel. And I stumbled upon a school in Scotland that was accredited by the APTA, and they had, I ended up going there.
That is so cool.
Yeah, it was really fun. It was really cool to experience healthcare in Europe and just sort of see how different things are. I knew that I could always come back here, and I ended up doing my last clinical in New York City. So I sort of got a good hybrid healthcare there and healthcare here.
Oh, that's really cool. Very, very cool. So did you end up I assume you didn't go straight into concussions, like concussion treatment, when you graduated. What kind of was the path that led you there?
Yeah, it's interesting because concussion isn't really taught in school. It probably is a lot more now.
Hope so.
But certainly when I went to school, it wasn't. You certainly learn neuro and you learn traumatic brain injury. And that was sort of the area that I was always in. I have done a whole bunch of things from inpatient acute care, acute neuro, ICU neuro, to outpatient neuro, to neuro rehab, like on a rehabilitation unit, and as well as ortho and all sorts of things. So currently, I treat a handful of things. Aside from concussion, but the majority of my career has always been in some sort of neuro field, which is why it was a really interesting journey for me, because I had my own injury in 2018, and I tore a ligament in my knee and I had a concussion, and all of my energy went toward rehabbing my knee. And the things that sort of we learn, like for treating neuro, really don't apply to concussion. And it was just really interesting to see, like, gosh, like concussion is treated really different than sort of your TBI population. And that was sort of how I started to dive into learning, partially to treat myself and then partially to help other people because I had struggled so much.
Yes. Okay. Thank you for sharing that. And I am excited to hear more about how you've developed your own program and your treatment facility. But it sounds like it was very influenced by your experience having concussions. So let's definitely jump into that. And I'm fascinated. I definitely want you to explain to us what differences you saw between the typical neuro treatment versus concussion, but we will get there. So let's start at the beginning. So your injury was in 2018 and it was a skiing incident. Is that right?
Yeah. So I was on a ski mountaineering trip in Chile. And yeah, it was the end of the trip and we were doing a big volcano kind of, last day of the trip. And I just, caught an edge and fell and tore my medial patellofemoral ligament, which is kind of like on the inside of your kneecap, and ended up having a long journey with rehabbing with that and was out of work for a while. Also sort of in there started to realize that I had a concussion.
So were you aware of it at the beginning? Like, did you know you had a concussion right away?
No, my knee it was the most painful thing I've ever felt, like pop, extreme pain. So all of my energy went there. I don't remember hitting my head at all. Yeah. And then I came home and had knee surgery. And then the first little clue was that it took me like probably 10 days to feel clear after surgery, like after having anesthesia. And I was thinking to myself, this doesn't really feel normal. Like, why am my head was just like in such a fog, in such a cloud. My mom had come out here to take care of me. And so she left probably after a week. That's what we had planned. I was like, oh, I'll be fine. No problem. I'd torn my ACL years before. And that, I felt after a couple of days, other than the fact that I was immobile, like felt like I could take care of myself. And I remember her leaving and my head was still just like not right. So that was sort of the first hint. And then, I was off work for a while because PT is such a physical job, especially in the neuro world where you're like physically moving people and just on your feet all day. I had planned to take a few months off of work. And so I kind of wasn't really in the real world. Like I was in my house where, I didn't even probably realize that I was keeping the lights low, or just things that we do naturally to just have a calming environment. I'd have a friend over, hang out with a friend here or there, but I didn't have a lot of like, I wasn't really in busy, socially stimulating environments with different lights and different noises and things like that. That as I sort of started to get back into life, I really couldn't tolerate those things. And then it really started to weigh on me.
Mm-hmm. And so at what point did you realize that was probably concussion related?
Yeah, I don't know, kind of in that period.
Mm-hmm.
Yeah, after maybe, I don't know, maybe a couple of weeks when I feel like my head, I should have been feeling better, except for my knee. Obviously it was a bit of a distraction because all of my energy was focused on my leg. So I don't know, maybe a month or two into it, I was pretty confident.
Yeah. Yeah. Tell us some of the main symptoms that you had. What were some of the things that you were dealing with symptoms wise? And you mentioned like feeling overstimulated by all the things, which makes sense. But what else were you dealing with?
Yeah. So I was extremely emotional and, it was hard to tease out, well, is this because of my knee? or, it's for anybody who's had a concussion or anybody that's worked with people with concussion, it's hard to know what's what. And then it's hard, your brain just really doesn't make sense of it. Like your brain just isn't processing emotion correctly. So even though knowing that, yeah, something that like might upset me is normal, you almost feel like it's exacerbated, and you know that it's exacerbated, but you like literally can't control it. I like to give the example of when I'd gone back to work, my lunch got thrown out and they were really good leftovers and I was really hungry, but I couldn't not cry. And I knew that this was very dramatic, but I just couldn't control myself. I was like, I know I'm being dramatic right now, but my lunch got thrown out.
I was really looking forward to that.
Yeah. And so I use this as an example because it's something that seems so silly. And to somebody else who hasn't experienced it, they're kind of like, get over it.
Right.
And you just physically, I know this isn't a big, like the reasoning skills are there, but your emotions just are all over the place.
Yes, I can. I know it's not the same, but I can relate. I feel like I had experiences like that when I was pregnant, like
Yeah.
the hormones and stuff. It's like actually, and around lunch too. I had an incident around lunch where I was just crying, and my brother was like, "What is wrong with you?" So
Yeah.
I
And
can
hormones are
definitely.
something I would love to touch on because I think that is a huge piece that is often overlooked or missed, and something that I wish I had looked into more.
Yes, absolutely. I put a note on here. I definitely want to come circle back to that as well, because that's a fascinating thing that needs to be talked about. So the emotions, I think you mentioned brain fog as well. Anything else?
Yeah.
Yeah.
Yeah. I've always been somebody who got headaches and they were a lot worse. I had really bad light sensitivity. I had some dizziness, not BBB vertigo type dizziness, but just sort of, I felt kind of out of it, just kind of like general vestibular system, just not totally working well.
Mhm.
My balance was a little off, but it's hard to tell. Was that because of my knee?
Right.
And then I started to notice, so one of the best things that one can do after concussion is exercise in the right way. But I did, I couldn't initially because of my knee. And then one thing I noticed that as I started to get range of motion back and I was able to ride a stationary bike, I all of a sudden felt these endorphins and I all of a sudden felt really good from exercising. And sort of in hindsight, that was one of the things that I've thought about a lot, is that I didn't really have a choice in what I could do because I didn't have range of motion and I was limited after surgery. But it was a bummer that I had to wait a while, that there was a little bit of a lag time before I could sort of start to get that oxygen circulating to my brain.
Mm-hmm. Yeah. Yeah. And I could see how that would be a potential concern with other like sports related injuries specifically. Yeah. That's an interesting point. I think another thing that you've mentioned a couple times that I think is worth pointing out is the questioning of, is it this or is it that? Like, am I feeling this way because of, like, our brain is involved in everything, and so it's so easy to just be like, oh no, it's probably because of this other thing. Like it's really hard. I think that's a really hard thing for people as they're trying to figure out, did I even have a concussion? Like, or
Mm-hmm.
could this be related to that? I don't even know. Like, there's so many things that are easily attributed to other things that could be having their root in a concussion.
Yes, and you question yourself. And I've seen that with clients as
Yes,
well.
me too.
Is you start to question, did this
Yeah.
even happen? How could this be this? Somebody's telling you, well, you just need to go talk to a therapist. And it's a little bit bigger than that.
Yes, so much questioning, like, am I just crazy now, or am I just
Yeah.
lazy now? Like all of these
Yeah.
like labels that we want to put on ourselves, but it's related to the concussion. So
100%.
yeah. So I'm curious, obviously you knew about concussions, you worked in the neuro world, but what about your concussion experience surprised you?
Oh, gosh. I think that I just sort of thought I would get better. I think that it surprised me, sort of the maybe lack of empathy or lack of understanding from other people in my world, just sort of, we all treat neurologic conditions, and then concussion really is this really special, unique thing that is just kind of difficult to wrap your head around. And especially if you haven't been there, it's particularly difficult. So that surprised me and was tricky for me to deal with as well.
Yeah, I could see that being the case. And it's interesting. I think especially it's understandable that people don't get it. Like one, it's invisible. You look okay, you're able to do certain things, but they don't see the toll that it takes on you. But
Yeah.
also like without having a diagnosis, it's not like you came out of that accident saying with a diagnosis, oh, hey, I have a brain injury. And like, and even if you did, you would be saying I have a concussion and people don't recognize that that's a brain injury, I think. So yeah, so I can see why people don't get it, or like how it would be frustrating that people don't get it.
Yeah.
Yeah, super interesting. So how did your life change following your concussion?
Well, I started getting really into treating concussion. I became really, really passionate about it and sort of changed the focus of my career into trying to find the best way to not only help myself, but to help other people. And some of the big things one of the big changes for me was I've always kind of worked in the hospital system and always, there are lots of guidelines and things that we do. And I was sort of always in the world of health insurance and things that are very traditional. I went to a doctor, they put me on a bunch of medication. And throughout this journey, it really actually has opened me up to sort of this other world that's out there that I think when you're in that world, you don't even know that there's a whole other world. And it can be very easy. And I am certainly guilty of it, of kind of like rolling my eyes at things that maybe are like a little bit alternative or not mainstream. And so that's been one of the biggest things for me, is just really opening my eyes and really being open to kind of a hybrid of, I love research and I think that, we should be evidence-based, but I think that there are other things that are adjunct that can be really helpful, and kind of questioning, well, are they not evidence-based just because nobody's done research, or are they actually quacky? So certainly within that world, I'm sure there are lots of things that maybe aren't great. But I think there are a lot of adjunctive therapies that I've started to adapt here in my clinic that I use myself and that I have really seen huge improvements in my being able to care for other people. So that's been huge for me.
Yeah, that's really cool. I'm curious to know, what were the things along this journey that have been helpful for you in getting to a point where it sounds like at the beginning it was really hard. Did you say you had to take time off? You had to take time off of work for your knee. Did you end up taking any time off for your head injury?
No, well, it was the same time. So I think you had asked me at one point when we were chatting, what kinds of things would you have done differently? And things that would have done differently is I would have taken more time off. I was fortunate in that I was working somewhere where I had a short-term disability and I could have taken more time. And I felt pressure, whether it was true pressure from other people or maybe it was my own internal pressure of feeling like I needed to get back. I had already taken 4 months and was sort of feeling this pressure that, oh, it's just your knee. Why are you taking so much time? And in hindsight, I should have taken more time. I had even talked to a therapist at that time that was like, I can write you a note for more time. But I think I just sort of felt like, just get back to work, get back into your routine. You'll feel better when you're in your routine.
Yeah.
And another thing that I feel like I would have done differently was gone and seen an integrative medicine doctor because I, at the time, got put on a lot of medications that I think in many ways, kind of like in terms of my autonomic nervous system, made me feel worse. And it's taken me a long time to get off of those.
Mm-hmm.
So,
okay, that is helpful to know. So what, when you mentioned you had a therapist that was willing to write you a note, was this for like a physical therapist for your leg, or was this for like
a psychologist? Yeah. So like I wasn't feeling great. So I went and spoke to somebody and they had recommended, maybe you can take some more time off work. Like I can, give you a note for work.
Was it helpful to have the psychology piece there? Or like, I know sometimes if somebody knows concussions, then it can be very helpful, but it's kind of with all of the practitioners out there. If you don't know concussion, it might not be as effective as it could be, but sometimes people get a lot of help out of it. So I'd love to hear your experience.
I mean, he was very lovely. I appreciate that he supported me and did understand, like, maybe you're not ready to go back to work, but I wouldn't say that it was particularly helpful. I think kind of back to why I wish I'd gone to see an integrative medicine doctor. I think that there is so much internally that is not balanced. Our hormones are so affected that I think that would have been changing it from the inside, I think would have been really, really helpful.
So what were the things that did help you get better from the concussion specifically?
Okay, so I was connected with a physical therapist who was really specialized in concussion, and she was incredibly helpful. And that was one of the things that started my journey on sort of seeing that PT can be really, really effective and doesn't necessarily need to be put in sort of this bin of like, you just do this one physical thing and sort of integrating the different systems. Another thing that was helpful was working with integrative medicine as well as I got introduced to adaptive contrast oxygen therapy. I don't know if you know what that is. I don't know if we spoke about that. Long story short, a guy I went to high school with had his own journey and opened a place up back east that had this, and he was posting on Instagram. So I was very curious, what is this thing that has this, it's called like a LiveO2 oxygen bike. And so he opened up a place back east. And so on one of my visits home, I went and did it, and it was amazing. And I decided that I wanted to invest in it. But basically what it is you ride a bike. And so you're getting a workout, you're getting your heart rate up, and there's two different settings. So basically, if you were to go up high on a mountain in elevation where there's less oxygen, your body's natural response is for your blood vessels to open because your body says, I want to survive, I want to breathe, everything opens up. And so the idea is that on this bike, you wear a mask and you can simulate this low oxygen environment while you're pedaling, while your heart rate's going up. It's very safe. And then you can flick a switch where you get 80% oxygen. So room air at sea level is 21% oxygen. We're at elevations was maybe 19 and a half here. But so you're getting 4 times the amount of oxygen in these open blood vessels. So almost the opposite of hyperbaric oxygen therapy, where you are using pressure to force oxygen into restricted vessels. The bike is using from the inside, opening everything up and then flushing in that fresh oxygen. And that was huge. I mean, knowing his story, I already was kind of sold on it. And then going and trying it just even once, I wrote it. And that night I was laying in bed and I could feel warmth like to one side of my head. And then my right foot had just like this burst of warmth. And it was just like blood flowing to places it hadn't been. Like it just gets into your teeny tiny little vessels. So I use that consistently for myself. And it's something that I notice a huge, huge difference in with my clients, just like getting them past those humps of just having headaches. I've had people come in here and say, I've had a headache for a month, and they ride it once and their headache is gone. So it's not as quick for everybody. Some people, if they're really, really chronic, don't feel great after the first 1 or 2 times. They just kind of have to push through and then they start to feel those benefits. But other people, it's like really quick. And especially with people with a really acute injury, I've found that it kind of like gets that healing going really quickly, just getting that blood flow.
That's so cool.
Yeah,
how far into your journey were you when you found that?
Gosh, too long. I couldn't find anyone out here that had it. I had saw that pretty early on that he was using this, but I couldn't find anything. And so kind of had to wait for him to open up his own place so that I could try it.
Try it and then make it happen yourself. I love it. That's so cool.
Yeah, it was cool. And then the other thing is red light in near far infrared light therapy, which I know is kind of all the talk of the town these days, but I think for good reason. So I have one of those here too.
And that would help
myself all the time.
What are the benefits that you find from it?
So it decreases inflammation, it increases blood flow, and it's really calming. And I've had people who have said, like with their children, that they've noticed a difference when they leave, and they think it's because of the red light, that their child is just really calm on the way home.
Mm-hmm.
Yeah.
So cool.
Yeah. And it also helps with your skin.
Hey, Another benefit. That's great.
Exactly. Lots of benefits.
Fabulous. That is awesome. So I want to ask kind of a more on the emotional side again. What things are helpful for you in like discovering and loving yourself post concussion? Because it can feel like a whole identity crisis. I know.
100%. Yeah.
Yeah. So what
And
was helpful for you in that on that aspect of things?
yeah, I have to say it's actually really reassuring for you to even be asking these questions because it is so validating because that's literally how you feel. Like you just don't know who you are and you question everything. And I had just like completely lost confidence. Things that were helpful were actually, restoring my system, like just getting my body working properly. I actually think it was more helpful when I was finally able to get off a bunch of the medications that I had been put on. But the problem is that getting off, you don't feel well. So sort of that fine balance. And for me, the bike was huge for that I was actually able to get off of them. I tried in the past and then I felt like one of them, every time I stopped taking it, I kind of felt like really dizzy. But the bike for me was huge, the bike and the red light. And then just, having a good support network, feeling physically strong enough that I could get out back outside and do all of the things that I love to do. I think that was sort of like coupled in there of like, that's normally my release is like going outside and being with my friends and being in the mountains and like doing hard things that then give me confidence. And I physically couldn't do them. So kind of just a little bit of time in the recovery process of being able to get back to myself. It's really helpful talking to other people who felt the same way, like even working as a clinician and having clients come in and them saying this. And I'm like, I know, right? It's true.
It's helpful for both parties in that. Yes.
100%. 100%. Yeah.
Yeah. Oh man. It is so it's so much. The concussion is so complex. It's like the hormones in the autonomic nervous system and there's just so much that goes into it. And I hope it's helpful for people to hear you say that you can get through that, right? Like it's okay when it's not okay. Like it makes sense that it's not okay, even though you might not be able to consciously and like really get it when you're in the moment of it, but just like please know if you're there, like that's not going to be forever. Healing is possible, and you can get to a point where you'll be able to look back and say, oh, this was my experience and now I'm here. So I just think that's an important message to get out there.
Yeah. And I think it's really difficult for people as well when maybe they're hearing different things from their physician and they just feel really frustrated and they feel like, is this just how it is? So, just kind of repeating what you just said, knowing that you can get better. You just need the right path and the right team.
Yes. Okay. Beautifully said. You need the right path and the right team. And those are out there. Just please know they are out there. And I'm curious with the medication piece, when you were seeing doctors that didn't understand it and were just putting all these meds in you, how did you go about? Did you talk to them about coming off of them? Or was it when you saw the integrative medicine doctor that was that person able to help you? Like the medical part, the medicine part is something that I am not like as an OT, that's not my realm. And so for me, I would be, what's your advice? I would be nervous about that. Like, how do you recommend people deal with that piece?
I mean, I wouldn't necessarily recommend other people do the same thing that I did, which was I just did it myself.
Okay. Yeah. We won't say that that's an official recommendation.
No, it is not an official recommendation. It's interesting. I mean, I really never went back to the doctor and said, I don't want to do this, or this isn't helping, or I wish you would recommend something else. I just sort of didn't go back to them. And then over time, sort of slowly weaned myself off as I started to figure out other ways to systemically make myself stronger.
Mm-hmm.
But don't follow that advice.
Maybe that would an integrated medicine doc, or just finding another doctor out there that does understand concussions and can help with that, like, because medicines are just a band-aid that are not fixing the underlying problem, right?
Yeah. I mean, there certainly is a place for medication in our world, but I think that what you just said, that in this case, looking at sort of what is causing the change in emotion, why do you all of a sudden feel sad or depressed? Why do you feel dizzy? Not just using a medication to make you not feel dizzy anymore. Why do you feel nauseous? Why do you feel all of these things? Why is your heart rate? This wasn't the case for me, but I see it with a lot of people. they have their heart rate shoots up when they just maybe stand up or are just doing basic things. And so, yes, that's very uncomfortable, but putting people on a medication that just stunts their heart rate, then over time causes more problems. So certainly, working with your doctor to sort of figure out a plan to, whether it's using it temporarily or getting to the root of what is causing this, which is where physical therapy can come into play. Because there is a lot that can be done with that. What I love about integrative medicine doctors is they do a lot of blood work and look at what is happening, like with vitamins and with hormones, in a way that a traditional primary care physician is not trained to do. So primary care is wonderful and wonderful for many things, but I think that they're very good at treating illness versus treating wellness. And so it's unfortunate because integrative medicine doctors tend to be cash pay or out of pocket. Sometimes you can get your insurance to reimburse some of it depending on what your plan is, but they look at things differently. An example that I'll give is that for vitamin D, we have all probably had our vitamin D checked, or we've heard about vitamin D seems to be this thing that everybody needs a lot of, or hears they need a lot of, and most people should be on a vitamin D supplement. But the general guidelines are pretty broad. And what an integrative medicine doctor told me was that yes, your level is within this normal range, but you're going to feel so much better if it's higher. So just things like that are really helpful, kind of dialing in nutrition. I think nutrition is huge. I try to talk to people about that. I have an online program as well, and I go into a bit about nutrition and some basic supplements. I'm not a dietitian, but in concussion courses, you do learn about nutrition and some basic supplements that are recommended. So working on things like that, I think is just so helpful, just getting the body to work within versus sort of masking it with medications.
Yes. Okay. I love you just touched on so many things. And I'm like, oh, we might need to do another one of these because I want to like dive in more, and we don't have all the time in the world today. So we might have to do a second one here. But and I do think, like you said, I think it is important to say out here too that medication can be very helpful and very necessary. So talk to doctors, and maybe an integrative medicine doctor might be a good option. But yeah, just throwing that out there because I think that's so. But I do appreciate everything that you said, and it is important to be working on the underlying causes. So I think that's important. Really quickly, tell me if you, this is something that I really feel is important to bring up in as many conversations as I can, because I think it's really key. But what advice would you give to people who are loving and supporting someone who is dealing with a concussion? Because there's a concussion happens to everybody. I mean, even though like one person has their brain injured, but it affects everybody. So how do you recommend the support network supports?
I think just to keep giving them love, and understand that they can't control a lot of what they're feeling or saying or doing, and maybe just keep giving them love and support and help, trying to just be there for them. Yeah, maybe, education, listening to things like this to help to understand or see other options. At the time for me, even being in healthcare, I didn't even really know that there were all of these other options. We talked about integrative medicine or just sort of these other sort of adjunct therapies that can be really helpful. So even kind of listening to things like this and making suggestions.
Yes, that's a good point.
Yeah. You're from the coaching perspective, I'd love to hear some things that you have to offer for friends and family members of somebody who had a concussion.
Yeah. Oh, similar things. Like a lot of times what I hear, I like gathering information from people who've had the experience. I can just share what I've learned from everybody else. But yeah, what you said is huge. Just loving them and being there for them and educating yourself on what it is and being an advocate for them, because sometimes they can't think clearly themselves to know where to look or what to do or how to stand up for themselves or say, hey, this is what I'm experiencing. Once their brain is like past the point of no return, they can't describe what's going on for themselves. So if you can be there and see that and help talk to teachers or to the therapist that they're working with and explain it, or to the doctor, whatever, I think that's huge. and taking care of themselves. Like it's a load. It's a load to be caring for somebody else. So you need to make sure that you're getting the support that you need as well. So easier said than done, and I get that. But it's a journey that we're all on together, and I think it has potential to really deepen relationships and love between people. So I think that's maybe helpful to remember too. Is that it's hard, but there's the compensating goodness that comes from that hard, if that makes sense. So, okay, so I really do think, because I want to ask you about the difference between the typical neuro and concussion and treatment versus concussion treatment and hormones and like all the things that you mentioned. But I want to make sure that we get a chance for you to talk about what you're doing. And maybe that would be a good segue. So what did you notice was the difference between typical neuro treatment versus concussions, and what have you done to fix that? Like to put goodness for concussions out into the world.
Yeah. So typical, TBI treatment. I worked for many, many years in the inpatient rehab and the outpatient neuro clinic. So sort of once people leave the hospital, then going into the clinic, and the treatment has this wonderful multidisciplinary approach where you have physical therapy, occupational therapy, speech therapy. The goals are a little bit different. You're not necessarily looking at symptoms, at kind of treating symptoms and then treating what's causing the symptoms from within. We're looking more at function. Can you walk? How's your gait? Can you communicate? How are your cognitive skills? You can weigh in more from an occupational therapist standpoint, but being able to do your ADLs and IADLs, and being able
those are activities of daily living, in case people are not aware what ADLs are. Sorry, go ahead.
No, it's okay. Thanks for saying that. I know. Yeah. So it's looking at it through a different lens and a more, I think, in many ways, diagnostic lens of looking at the, why are you feeling this way? And then sort of looking at it from the standpoint of backing up and saying, okay, well, what is a concussion? A concussion is this energy crisis in the brain. So we don't have necessarily structural damage. Different areas of the brain are affected, but really what's happening, there's this blood flow issue, and there's this chemical release issue and hormone imbalance. And so, and there's a vestibular issue, right? Like if you fracture your temporal bone, there's a 100% chance that you are going to have vestibular dysfunction. Mm-hmm. So looking at things like that, where I think sometimes, especially when you work in a hospital, we get very used to working with people that have TBI that is just on a different level, and their physical function is very impaired. And that's what we're trying to do, is we're trying to get you moving again.
Yes. It's interesting when you're talking about that, it just reminded me of how it's so common. I think your case is a perfect example, but also, if people have receive their injury through a car accident or something, like the first priority is usually the physical body. Like we want to make sure that you're not going to bleed out, which makes sense. This is good. Like we take care of the physical body, but the impact on the brain itself is often not paid as close attention to, or at least, yeah. And because you're seeing different people, like the people who are seeing you at the beginning, they may or may not think to mention to you, oh yeah, by the way, you might have some brain fog and some headaches, and like you might have some stuff going on after this, but they're there to take care of and make sure that you're staying alive and physically recovering. And I think that the brain part somehow falls through the cracks so often. But yeah, but with more severe TBIs, it does sound like it's more like helping with the physical part and with the concussion, there's more. It's not, like you said, it's not a physical injury in the brain. It is, but it's not like a permanent physical injury. It can be healed. It's more of an energy crisis. So yeah.
And generally people are walking and as they call it, this invisible injury, you kind of look fine. Yeah. And another piece is treating the neck. I mean, treating the neck is huge. And that's not something typically that we really do in the hospital for somebody with a TBI.
Interesting. Yeah. Okay. So tell us about what you do. Tell us about how you ended up starting your own clinic, and about I believe you have an online program as well for people who can't come in physically. So let's hear all of the things.
Yeah. So after being with the hospital system for many, many years, and sort of being kind of narrow-minded in that system, I sort of started to open up a little bit and see what else is out there and realize that there is this whole other world. While it was very, very scary to dive off the cliff and do my own thing, I have a very supportive partner who helped push me off, but he had a lot of confidence in me and knew that I could do it. I decided that I just wanted to do my own thing in my community because Park City does have a tight knit community, and it's really nice to be able to work in that community and to support this community. And I just decided that, I want to do my own thing. So what I do is according to the American Physical Therapy Association, there are 4 domains that should be treated by a physical therapist, and that's the neck, the visual and vestibular system treated together, the autonomic nervous system, which is a system in our body that controls all of the things we don't think about. So we talked a lot about hormones. We think about breathing. We don't say, body, breathe. Our body just naturally knows to breathe. Our body knows to naturally have blood circulate so that when you stand up, the blood pumps up. But these are things that start to not function well when you've had a concussion. You stand up and you notice you're lightheaded all the time. You get this pooling in your legs, or maybe you feel really, really hot or really, really cold all the time, or you had digestion issues. These are all autonomic nervous system things. And then complex motor and cognitive dual tasking. So depending on, everybody is so different, depending on sort of the areas that are not working appropriately, I run people through a program that sort of integrates vision with balance, with the vestibular system, and having cognitive tasks along the way. And then treating the exercise component with a very specific and tailored high intensity interval training coupled with my Levo2 bike, which is an integral part of the concussion treatment session. So people sometimes will come in for a full session that includes the bike, and then they'll even come in a couple times during the week to just ride the bike because it is that amazing. Like, you just get off. I should have you in. You can come ride it sometime.
Yes, please.
You get off and your head just feels so clear. It's like all of a sudden you're just like, whoo, all right, it's a new day. I'm in this great mood. And that's what people say as they leave and their head feels really clear. It kind of lifts the fog. It gets oxygen going. I also treat the neck and I use a lot of dry needling. And I use red light as well, kind of simultaneously with the dry needling. There have been some studies that have shown that it's actually more effective if you put the red light on while you're needling. So I use dry needling with electrical stimulation. And I also use a bunch of kind of manual cranial therapy techniques, some acupressure points and a little bit of lymphatic drainage and things just to get, we don't think about, we have lots of bones in our head. As a physical therapist, we would mobilize, maybe the bones in an elbow or a wrist or do joint mobs in the back, but our head has bones, and sort of moving things around and getting fluid moving and can be really effective as well.
So cool. So when people come, well, actually tell us about the online piece as well.
Yeah. Almost forgot. So I developed an online program as well for people that are not here in Park City or people that just want to be able to do it from home. So it is just a one-time purchase where I walk you through. There are 9 chapters on sort of learning what a concussion is, learning about the visual system, learning about the vestibular system, learning if you have vertigo, benign paroxysmal positional vertigo, or BPPV, otherwise known as having crystals in your ear. Some people have heard of it that way. That causes this intense spinning that can be overlooked. People don't even realize they have it. And that can be kind of a quick fix to, why do I feel dizzy every time I lay down or bend over? So going through all of those things, learning about the autonomic nervous system, and then giving a bunch of management strategies. So just sort of some education on sort of, what the guidelines are now. So previously there was this mindset of being in a dark room, no screens, and things have sort of changed. So now the guidelines are sort of like relative rest. So not going out and completely doing everything, but not completely withholding from everything as well, because as we've learned, that actually can make you worse. So getting little bits of light stimulation, little bits of noise stimulation, little bits of screens, socialization, all of these things. And I give, some tangible things like a hydration tracker that you can use to sort of track your water intake. I talk about nutrition, how important sleep is to recovery. Sleep is so important. There was a time where we were waking people up because we didn't want them to sleep. Or we were afraid that if they slept too long. Now the recommendation is, unless somebody's not waking easily or they're sleeping during the day and not sleeping at night, that sleeping is excellent. It's when our brain heals best. And then it also includes 14 days worth of exercises. So I walk you through 14 days of exercises that then you can go back, you have lifetime access to. You can go back and keep continuing to do the exercises. And the exercises are everything from mobility exercises to visual, vestibular, all the things. And it includes an aerobic interval training component.
This is amazing. I think that sounds like it would be so good for people. How can they get that? How can people find you or come to work with you in person or access your online fitness?
So it's on my website, which is www.happybrainpt.com. You can always email me if you have questions at annie@happybrainpt.com.
Yeah, and those will be in the show notes as well.
Sorry, say that again.
Oh, I said those will be in the show notes as well. We'll put them so that people can click the links if they want to. But that is fantastic. Thank you so much. I just want to ask you one more quick question before we hop off. This is just in relation to the autonomic nervous system and all of those things. I would love to hear any tips or tricks or things that you found most helpful for you in like calming the nervous system down, kind of like an in the moment, relaxing, helpful tip.
I did find after a really busy, stimulating day, laying down and listening to nature sounds and just kind of having something really calming. And for me, the red light, just lying in front of that with or without the nature sounds. Even sometimes I like silence, but I noticed that initially I didn't like silence because my head was spinning so much. But as I started to heal and get better, I appreciated the silence more. So those were really good things that were helpful, as well as some vagal nerve stimulation is always good. Kind of get that parasympathetic. Yes.
I love it.
I don't know if it's dark, you can see. Get that parasympathetic nervous system working.
Beautiful. Love it. Okay. Well, thank you so much. I really do. If you're okay with it, I might bring you back on because I feel there's more that we could chat about.
I know, that went by so quickly.
Good. Awesome. Well, thank you so much. And yes, people check her out. I will, again, put that information in the show notes. And I love what you're doing and love exposing people to hearing about this goodness that's out there. So thank you so much, Annie.
Yeah, thank you for having me. And I love what you're doing. I think the concussion coaching is just so needed and so important. So glad that we get to team up.
Yes, me too. Thanks so much. I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.